I want to tell you something about your healthcare that almost nobody ever says out loud. You are the most important person on your healthcare team. Not your doctor, not your specialist, not your pharmacist. You. But here's the problem. I see this every single day. Most patients don't know that. Nobody ever explained their role in the system. Nobody handed them the playbook. Today, I want to give it to you. My name is Milca. I am a nurse practitioner in primary care, MetroBest Health, where I help women in their 40s and their 50s navigate the hormonal changes of perimenopause, menopause, as well as midlife health. But today's message is for everybody really, because no matter your age, your diagnosis, or how many specialists you see, every patient needs to know how to navigate our healthcare system with confidence. I want you to think about healthcare in a little different lens. Think of it like a team sport. Let's say football, for example. Every player in the team has an important job. The cardiologist focuses on your heart. The gynecologist focuses on your women's health. The endocrinologist focuses on women on hormones. Your pharmacist helps make sure your medications are safe. Your primary care provider helps coordinate many aspects of your care. Every member of the team has a role. But here's one role that belongs only to you. You are the quarterback. The quarterback isn't expected to know how to play every position. Their job is different. They understand the entire game. They communicate with the team. They make sure everyone is working towards the same goal. That's your job in the healthcare team. Now, I know you're thinking, well, shouldn't that be my doctor's job? Shouldn't my doctor be the quarterback? And it's fair question. But here's why that doesn't work. Everyone on your healthcare team is seeing one part of your health. Only one person sees the entire picture. You. You are the one who knows every provider you see, every doctor you see. You are the one who knows every medication you take. You're the only one who's had every recommendation from every appointment. Only you can see the entire field. Here's something that surprises many people. Your healthcare providers are not automatically talking to each other. Sometimes they work in completely different healthcare systems. Sometimes they use different electronic medical records. Sometimes specialists send consultation notes, sometimes they don't. Even when information is shared, it isn't always available immediately. That's simply how the healthcare system works today. So many patients assume, well, they already know. Sometimes they don't. Let me give you an example. Your cardiologist starts you on a new blood pressure medication. A month later, you see your primary care provider. If you don't mention that change, your primary care provider may make another recommendation without realizing something changed. Nobody made a mistake. Information simply didn't make it from one part of the team to another. And you are the one who can close that gap. The good news is you don't need a medical degree to be a great quarterback in your team. You simply need to communicate. Here are 4 habits that make an enormous difference. Number 1, know who's on your team. Keep a simple list of healthcare providers, their names, their specialties, their phone numbers. Even a note on your phone works. When someone asks you, are you seeing any other specialist? You know exactly how to answer. Number 2, when one member of the healthcare team changes the game plan, tell the rest of the team. A new medication, a new diagnosis, a new hospital stay, a new specialist. These aren't small details. They are part of your healthcare playbook. Something as simple as saying, my cardiologist started me on a new medication last month, and I wanted to make sure that you knew, can prevent confusion later. Number 3, share your records when it matters. If you recently had blood work, an MRI, a hospital say, or imaging performed somewhere else, and you happen to have those records, say or at least report that, or ask the office to send them before your appointment. The more complete information, the better decisions your healthcare can make, your healthcare team members. Number 4, speak up. If a treatment isn't working, say so. If you're having side effects, say so. If something doesn't make sense, ask. You're not bothering your clinician. You're giving us information we need to help you. The best healthcare relationships are partnerships. I also want to talk about second opinions. Sometimes patients worry they'll offend their provider because, please, medicine is complicated. Getting another opinion is completely reasonable. Sometimes another clinician notices something that wasn't obvious. Sometimes they simply explain things differently. Healthcare providers understand that. But here's the important part. Don't disappear. Don't quickly change doctors without telling the rest of the healthcare team. Imagine a quarterback who changes the play but never tells the players. Imagine bringing new teammates onto the field without telling anyone they are there. That's how confusion happens. When healthcare team knows who's involved, everyone works together more efficiently, more effectively. The best healthcare outcomes I have seen over my career have something in common. Patients become very active members of their own healthcare team, not because they know more medicine than their doctors. They don't, because they come prepared, because they stay informed, because they communicate. The next time you walk into a medical appointment, I want you to remember something. You are not a passenger. You're not sitting in the stands. You're on the field. You are the quarterback. And the better you communicate with your team, the better your team can care for you. Because the most powerful person on the healthcare team isn't your doctor. It's not your specialist. It's not your pharmacist. It's you. Because you are the only person who sees the entire field. If this video was helpful, I'd love you to subscribe. Every week I share practical evidence-based information to help you better understand your healthcare and navigate the healthcare system with more confidence. And if you know someone who has multiple doctors, medications, complications, share this video with them. Everyone deserves to know their role in the healthcare team. And I'll see you in the next video.